of the Summit 2026. The day one was amazing because we went to the village, although it was late in the afternoon, but we still did enjoy interacting with the community people. And I know most of you would have been tired, but still I thank you for making use of the opportunity that was given to you. And you're back today here to have a discussion based on what you have interacted with the community and what you have observed. So I request all of you to actively participate in your group and contribute to this discussion, because this is what is going to help the community. Your observation and suggestions will take this 4 villages to be represented at the collector's office, and whatever need that we can do at our level as a higher education institution and the public around us and the Tiruvallur district, we will definitely try to do it. But kindly interact, give your suggestion. It should not be just one person always talking in the group. And I request the coordinators to sort of take control of the group now. Thank you very much. So we start the discussion now. And we stop it at the time that it is announced. Thank you. To give the guidelines now. Thank you.
Thank you, Dr. Mary. So, all participants have been seated in the group, in the village groups, right? Okay, before we start the discussion, I would like to know about your reflection on your experience yesterday. Just one representative for each village lah. Is it okay? Okay. Can we start with Melendur? Can I have one representative to share the reflection? The reflection, what's your experience yesterday? Not about the issue, yeah? What you feel?
Okay. So, from Malandur, first, our experience was very good. And first, I would like to say, when we went to the village, and actually, we didn't much have time to explore all the houses, but gathered the people from the village, and we asked some few questions, which mainly focused on what is their livelihood and how they survive and what is their economic. So with the overall perception of the community was they are happy with what they have. So that is I think the take-home thing, being as a group, I would say. And mainly they had few issues like basic medical facilities is one of the major issue they were suggesting to the group of, because even they don't have a primary health center, which is not, they have it, but they are not functioning, and also they have issues with the education for children, because they have only the middle school up to their village, and they have to go away about another 15 kilometers to, and also they don't have the proper transport.
Okay, so thank you, sir.
Thank you.
The other issue we will discuss later. Yeah, just one. I will ask first. Okay, thank you very much from the Melendur. So now next, I need the representative from the mayor who would like to share the reflection, what you learned, what interesting part when you do the FGD with the villagers. Yeah, please stand, and maybe you can stand here so everyone can see you. Go. Okay. Yes.
So thank you, and very good morning to one and all gathered here. And yesterday, the village was amazing, and till now I attended many conference, In many conference, the speaker will speak and we will used to listen. But this is the first time I'm practically going and visiting the village and attending the conference and visiting the village and to know about practical difficulties, what they are facing and what they are experiencing. And our team was amazing to listen all their queries, and we noted down, and the group discussion going to be and very useful, and practical challenges and basic needs also they don't have in the community, but we have a lot of facilities in our home. Yesterday I wondered that we have all the facilities in our home, but we are not gratitude to it. But basic facilities also they don't have, and happily they are living in the village. So it was amazing, really. Thank you.
Okay, thank you, ma'am. So next, I will go to Arikambato. Any representative?
Good morning to everyone.
Yeah, everyone can see you.
Good morning to everyone. So our team, we visited Arikampattu village, where there is a small hamlet of Irula tribe community there. So it was a very great experience for us because we were able to distinguish between what is an urban community and what is a rural community, and what are the needs and facilities the rural community people have. And there is a lot of issues in accessibility to education and other basic facilities and needs. And we did a kind of a focus group discussion where we did a small need analysis for the community, and we were able to prioritize those issues and categorize in every other categories. And this conference, what they have did is a very great innovation, because we were able to really get a full-on knowledge about rural communities through this village immersion program. Thank you.
Thank you so much. Okay, the last one from the group, Kalpato.
Very good morning to you all. It was a very unique experience visiting a small hamlet, and it is little isolated from the main city. So there are a lot of issues like basic amenities. There was a good ambience, like we had divided our group into two, so that we have a very personal, intimate discussion, because a larger group, it is difficult. So one group was in a church and another group was in a community hall. So it was really good, and women were more active than the men. Men were not available, they went to work. So we had a lot of interaction with women group, and discussion about many facilities they are lacking and what they want. They develop a confidence on us, and really very good interactive session, and we have facilitated, our professors facilitated very well. So we had a very live and thriving learning experience today. We will share the details through the presentation. Thank you.
Thank you so much, sir.
Mic is not working.
Okay, so I think everyone have learned a new, unique experience from the village immersion program, right? So without further ado, maybe we can continue to our discussion. So we will have about 20 minutes maybe. Is it enough? 20 minutes only. Because I think the slides are already done. We just need to recheck. Either the team need to recheck also all the slides. If the points are good enough, or you need to improve more points. And you also need to see the 3 prioritized issue that has been chosen. The 3 prioritized issue. And then is it the best proposal, or you have another idea? So this all the findings from the yesterday program, each group will be need to present a letter. Each group need to present about 10 minutes. I will give extra 5 minutes if need lah. But we stick to the 10 minutes presentation first. Okay? Okay, thank you. You may start your discussion.
for your kind attention. The discussion will get over within 5 minutes. I repeat, for your kind attention, the discussion will be going over for 5 more minutes.
Check, check. Check, check.
Your attention, they're crossing the 5-minute deadline. Yes, Kalpattu is finished. Arikambettu is ready. Ready? What? Arikambettu, fantastic, very good. Mayur, are you ready? Very good. Yes, they are ready. But no, others should. No, Shiza, Shiza, Shiza. No, it is not the reverse side, okay? Everybody should listen to each other's presentation. Your countdown starts now. 3, 2, 1, 2, 1. You're extending the 1 minute for 5 minutes. 5 more minutes. The session will be over. Done. Thank you so much. So all the team, Kalpattu, Mayur, Arikambettu and Malandur teams, attention please. Thank you very much for this wonderful discussion. Please clap for yourself. And now I will, Dennison sir, you will take over or Saiza will do it? The reporting, where is Saiza? Saiza engekkan? Where is she? Okay. So she takes over the session, right? Or I would ask them to do the presentation. I will do that. Okay. I hope the presentations have reached the technical team. 4 presentations vandircha. Meenakshi? can move your chairs so that you can see the presentation of the others. You can move your chairs and see forward. Done? Okay. இங்க வந்துரும் டிஸ்ப்ளே ஆயிடும். ஆமா. So we have the first team from Mayur. Mayur, who is going to do the presentation? Who is going to present the slides? இங்க முன்னாடி வந்துருங்க. Slides will be displayed here. And my You want someone to join you? Kindly introduce yourself and the village that you represent. The slides will be shown.
Okay, ma'am, sure.
Thank you. Good luck.
Good morning, everyone.
Time starts now.
So, I'm Dr. Uday Bonu from the Department of Environmental Sciences, Bishop Hebrew College. So, we visited the Mayur village yesterday. We had a visit over there. We discussed with the village people and all the members along with my team. We found out so many issues over there, and also we discussed it right now and we made some solutions. She is my team member.
My name is Subulakshmi. I am from an NGO. We work for government school students in water sanitation hygiene throughout Tamil Nadu.
It is not displayed, it seems. Anyhow, I can share some things yesterday what we have learned over there. The main thing we focused is the three pillars of the SDG, that economic, environment and the social thing. We found out so many things. Through that, we identified the three important things as a prioritization for that particular area. The people yesterday, they mentioned there is no frequent transportation. There is no bus transportation. Every day, only once the bus will come in the morning and it will go in the evening. There is no proper bus transportation. That is the main problem over there.
Then they were discussing about the public toilets, because in each individual house, some they are not having enough space, so they want the public toilet, and also it should be accessible. It should be near, which is very far away, because already some toilets are there, constructed by government and one NGO also, but it is very far. Due to some reasons, it's not getting functional. So they want the public toilet to be available.
And another important prioritization is about the primary health center. There is not even a single medical shop over there. The tablets, the basic tablets like headache tablet or any other ointments are there in the petty shops only. So the primary health center, the building is there, but it is not in the proper running condition. There is no medical facilities at all. There is no proper health care over there. The people are not aware of their own health. But weekly once they are having some mobile hospitals is coming and they are visiting. But there is no proper primary health center at all. And there are people who are qualified with the nursing, and so many degree holders are there, but there is no proper investment or employment. So they are also in need of some employment opportunity. That is one of the prioritization. So here these three we consider to be a mandatory one. And through this slide you can see where it is located and how many households, and more than 700 people are there, but there is no PHC and there is no library and there is no community hall, but still people are there over with full of happiness, it seems. And also they are having safety issues with the children, especially the women children. As there is a bus transportation is very less, they have to cross over the task mark. So some safety issues are needed for them. That is one of the things we identified yesterday. And these are the target group presented, the women self-help group. Then we divided the women fellows into two different groups, as one a single parent and widow, and all the older one as a group, so one group, and the middle-aged women and all the family women are considered to be another group. And both the group we got a different type of result.
Best practices. The best practices we found was the self-help groups. They said some 50 self-help groups are there, and they are working actively also. Bookkeeper is there. She is keeping all the records, and 100% they are very active. Yes, and there were also many women who know tailoring. They came up and they have learnt so much by their own.
So through the pictures you can see, these are all the members we visited yesterday. We sat together, chat together, and we got so many informations. You can see one of the picture over there, an abandoned building. That is the primary health center over there. And a nearby library is also there. And we had a group discussion. And you can see one of the women who is sitting in front wearing the specs. She is the one who is leading the SHG. 53 groups are there. She is the one having all the records and accounts about all those self-help groups. And this is the frontal Panchayat board. Of Panchayat office. Okay, next slide. So next. So this is the thing I told you in the earlier itself. So limited access to education and skill opportunity, and safety concern, and caste-based discrimination in opportunities. So through this we can identify the 3 prioritization, and we are planning to give solution for all those identified issues. And it also related to the SDG, quality education, gender equity, good health and well-being, and also the partnership with the institutions. So finally, what I can say is, being an adopted village, the institution can invest in something and make and to provide a chance or an opportunity to the women who hold the longing for a chance to work. Because of family commitment, the women are not able to go out, and there is because of the bus transportation. So being an adopted village, we can, that means you can invest and help them. That is the presentation of us, Mayor. Thank you.
One or two things. I just want to add something. The SDGs can be strengthened still more, but what now they are doing is they are getting loan and repaying, getting loan and repaying. That's all the work they are doing. What they can do is they can generate income also. They can find a public place or public land. They can grow greens and small vegetables. Instead of selling outside is one more thing, but they can have it for them. They can first taste it. They can have it a nutritious value from it. They can do that. Another thing is proper income means they can now grow moringa everywhere, because it's not much needed. It will come out in any soil. But the moringa, it has to be dried. So approaching any CSR companies or NGOs, we can provide them with solar, and they can produce solar dried moringa powder also. These 2 incomes they can make it.
And through this slide you can see the main issue about water scarcity and the lack of rainwater harvesting, natural disasters, cyclones and flooding. For this they had some issues. So this proper systems can be used in a proper way. Thank you. Okay, thank you. Thank you everyone.
Thank you very much. I would request the entire team to come forward on the dais here so that we can take a group photo. Please come. Mayu team alone. Mayu with the coordinators. Thank you. Thank you. So I request now the Arikambatta team to come forward. We can bring one more person with you. Do you want to come as the entire team? எல்லாரும் வர ஆசைப்படுறீங்களா? Okay, all of you can move forward now. Please occupy the dais. Presenters நடுவுல வாங்க. கரெக்ட்டா பொசிஷன் பண்ணிக்கோங்க உங்களை. Please come. வாங்க. Come fast. We don't have time. உங்களோட வந்தவங்க யாரு? சார். டாக்டர். இப்படி வாங்க.
Belongs to our team.
Doctor also belongs to us.
Good morning, everyone present here. The team, the village, what we are representing here is Arikambattu. So we have received more issues in the Arikambattu village before going on to there. The profile is in front of you. Arikambattu village, it belongs to the Tiruvallur district and Guruvayur Panchayat. The main thing is here is, it is a irregular tribal hamlet which has a 45 household. The community is an indigenous settlement. They are residing there over for more than 15 years. And there are 150 members in the community. Their main economic activity, what they have involved is, they will be involved in flower picking, onion farming, and also they work as a daily wage workers, and they will be working in a phenol factories. The target group we have covered yesterday is men, youth, women, senior citizen, and also children. The best practices available in the community is, we could see a community cohesion among the members, and also all families are using a solar panel with the inverter, which is funded by the Nazareth College of Arts and Science in collaboration with Selco and Bank of America. When we are moving on to the main issues, next slide please. So these are the issues what we have found in the social perspective related to school dropout and educational access. Children in this irregular tribal community have to walk for 2.5 kilometers. They don't have a transport facility. So this made them for increase in the dropout rate, and also there is inadequate housing. Due to there is no proper land entitlement for them, since they are migrating from one place to another. And also government is ready to provide a patta for them, but they are providing the land entitlement not in the place where they are residing currently. They are providing the land entitlement in the another place called Melkondayur, but the livelihood opportunities or employment opportunities for those people, it becomes a main question mark for them. And also we could observe that there is a indirect cause discrimination among the community members, especially in the worshipping places. And when we are talking about the next perspective, economic perspective, next slide please. So there is an unstable livelihood income among the members, especially with the women. When we are talking about the employment in this particular community, it's only seasonal. For 6 months they will be involved in the flower picking, and for the 6 months they will be involved in the onion farming. So they will get advance from the landowners, and they will and they will work for the remaining 6 months. So here comes the unstable livelihood and income for those community, and also limited employment opportunities are there among this community members. And another main findings here is there is a lack of savings awareness and SDG self-help group participation. They don't have awareness about the savings, and also they also don't know the concept of self-help women, since this community is facing a problem related to a financial instability. If they know about what is meant by savings or what is the concept of self-help group, so they can grow into the financial stability. So this is also one of the major findings. And then when we are talking about the environmental perspective, next slide. So there is a temporary water shortage for them due to ongoing construction, and also poor infrastructure and rainwater flooding during the rainy season, and lack of sanitation facilities and open defecation is prevalent in the community. This community, they don't have neither a community toilet or an individual toilet, since they don't have a land entitlement. The bathrooms or the toilets, how they will use they will just use a sticks surrounded by a cloth. They will use in that manner, so they don't have a toilet facilities. So the sanitation become a very big question mark in this community. And at last, when we are talking about the governance perspective, limited institutional outreach. Since this community is away from the main villages, the healthcare services or the visits by the officials, it's very limited. And also there is a delays in housing scheme implementation because they have been allotted in the different place, and also they have allotted only for a 2 cents where they needed a 5 cents of land, because in the 2 cents of land they cannot afford for that, they cannot have a proper standard of living. And the next one is inconsistent welfare distribution. Old age pension scheme is available in the community, and other welfare measures also available, but it's not reaching everyone in the community. So these are all the main issues where we have found. Among these main issues, we have prioritized the 3 main issues. Next slide, please. Next slide. So the 3 main issues where we have prioritized and proposing for the solutions is, the first one is lack of self-help group participation and financial instability. So if we concentrate on the women and we train them in the financial literacy and make them as a self-help group, it can lead to a financial stability among the community members. And the second one is lack of sanitation and open defecation. So we have a government scheme called Swachh Bharat missions, and the various Rotary clubs and other organizations are also working, especially in the sanitation perspective. So if we made a proposal for those organizations or a government organization, we can come up with the solutions. And the final one is educational dropout and access barriers. We have a government scheme called Samagra Shiksha scheme, and also residential schools called Eklavya, especially for the tribal people. If we concentrate or raise awareness among these students can here we can reduce the dropout rate among these community members. Thank you.
Okay, with regard to education, what we observed is not even one girl child. There were 3 generations sitting yesterday. So in that generation, if you say only one girl, she passed 12th standard. So the remaining of them, not even one fellow passed beyond the 12th standard and went to college. So there is no role model existing within their community to understand what is the role of educating women for them. So if it is one breakthrough happens also, it will be a great thing. And they were also saying that though we are saying the children are dropping or they are not interested, one of the major crises, the 2 families were discussing. One family could afford bicycle, and the children are 9th standard and 8th standard, they're going to school. The other child, girl child, she dropped out in between the 10th standard because she was not able to go to the school. It is very far away. So there may be small nitty-gritties, even those kind of gaps if we fill also, I'm sure the community will witness what is the fruit of education. And there is no pathway for them to visualize what is next for them, right? So they may say, okay, the government is giving free education. There was a fantastic primary school. with all, even the digital classroom like these boards and all that. So the children go somehow up to 5th standard. After that, they are not going. So the dropout happens between 5th and the transitioning to the high school. So the lot of dropouts are happening there. Very systematically, strategically, you have to plan in terms of admitting the children back to the school. And they were also saying that children to children influence each other. There was a case study, she was saying that the lady who was leader, took the position of a leader who was speaking to us. She also did a small community tuition center when Don Bosco was helping them. So when the community tuition center was there, she was able to help the lot of tuitions in the evening doing homework. At that point of time, there were no dropouts. Soon after the project got winded, and she is not getting informed, there is no way, there is a community level monitoring for support system for the children. And so that is one of the reasons we could highlight that education dropouts. Though all of them said that they are all from Irula community, there is provision in the government, up to your PhD also you get free scholarship. But absolutely they don't have awareness. What are the benefits they can enjoy? What are the things what education can do? Not even one government employment happened in the community. So that's the status of the real India. Thank you. Thank you. Did a good job.
So thank you very much for the village. Photo எடுத்தீங்களா? Group photo. இருங்க, group photo எடுக்கல.
Official camera la
எடுக்கலையா? Group photo.
ரெக்கார்ட் பண்ணோம்ல
எடுத்துச்சா?
இன்னும் எடுக்கலையா? தெளிவா இருக்கு. அரிக்கப்பட்ட வர்த்தனாதி டாக்டர்
அவர் கால் பண்ணி
அது என்னது?
கால் பண்ணி
கல்பர்ட்டில் போய் ஜாயின் பண்ணிட்டீங்க டாக்டர் நீங்க.
Thank you.
Very well presented.
Very good.
Thank you, Arvind. Now we have the Malandur team to present. You got 7 minutes extra, actually. Please come forward as a team. Thank you. We want the presenter here and the team leaders in the center, and all the others can occupy both the sides. Please place yourself properly so that we can take a group photo. If the presenter has missed out any points and you have some suggestions, always you're welcome to voice it out. Yes. Please come this side too. Slide வந்துருச்சான்னு பாருங்க. மாலந்தூர். இல்ல இங்க முன்னாடி பார்த்து நில்லுங்க. அப்படி கரெக்ட்டா இங்க ஒரு யூ ஷேப்ல நில்லுங்க. யுவராணி. எல்லாரும் தெரியணும். Okay, thank you. Okay, Malandur team, here goes.
Good morning, one and all present here. So we are here representing Malandur village. We are really happy and glad, and we are very privileged to talk about this Malandur village. I can say like this. See, we had such a interacting with them yesterday. My name is Mano. I even thought like this, Malandur Mano. You know, that sort of attachment we had yesterday, because the interaction was so nice. So we are here to present whatever the data we received yesterday. Next slide, please. So
this particular village belongs to Tiruvallur district, and according to 2011 census, the male population is 894 female and 992, male is 894 and female is 992. Literacy rate is for male 82.1 and female 58.7. And the main economic activities are agriculture, construction business, construction like daily wages and 100 days work. And the target group presented yesterday was youth, students and 100 days work beneficiaries, women farmers and school HM and the construction workers. The best practices, what we have noticed in this particular village is public library is available and unity among themselves. Next slide, please. Next one. And the social issues, whatever we observed yesterday, lack of access to education, it means like they all go for education up to 12th. They go up to 10th, and few they go up to 12th, and very less they go for higher education. And that's the main issue. And lack of healthcare facility. There are no clinics available or no PHC available in the village. Even for the fever, they have to go for 8 kilometers away. And one thing we have noticed is during pregnancy, that was the highest issue. Like even for the delivery, they have to travel either 8 kilometers or to the hospital 20 kilometers. And they don't have any transportation available. They have to call for 108, the ambulance. They need to wait for the ambulance and they have to go by the ambulance. So even for the delivery, they have to travel such a long time. Otherwise, for fever and everything, they are traveling 8 kilometers by bike. So this is the major issue which we found there. And child marriage. And child marriage is again another main issue we found there. At the age of 15, they get married, the girl children. Recently, it happened 2 months back. So which is very known, and there are unknown marriages are happening. This one, we got it from the principal, the HM of the school. She said one of her student got married 2 months back, which was age of 15. And she was really worried, and she was really upset about it. And she said like this, if it is going to happen next time, I'm going to complain. That's what she said. This is a known cases which we got it from the mouth of HM. But there are unknown cases which is happening, child marriage in this village. And the next one is gender discrimination. Married women are more affected due to alcoholic addiction of men. Most of the men are addicted towards alcohol. Because of that, the women group are really affected because they drink and they come and beat the women. They said like this, நாங்க பேசாம இருந்தா எங்களுக்கு அடி விழாது, பேசினா நல்ல அடி விழும். It means திருப்பி பேசினா. If at all the men is drunkard, and if anything the women is giving back again or talking back, they'll be beaten. So that's what they said, and this is the issue. And drug usage, this is slowly coming inside the schools. And this is really pathetic because of lack of awareness. 6th standard, 7th standard students are started to use drug. They are not aware how these drugs are coming inside the classroom. Slowly coming in, that's what they said. It's not kind of addiction yet, but it is coming inside very slowly, and the students are started to use it. And we believe that's a very huge issue for the student community. And next is petty crime. Outsiders stealing like cows, goats, and from the villages. This is seasonal problem. Very seasonally, outside village people, they come to this village and steal their own things. And the literacy rate, low literacy among the elder community. Almost 20 to 22 people, yesterday they came. We asked how many of them have studied up to 12th. Only one person she raised. Only one woman, she studied up to 12th. And another one up to 6th. That's it. So it's the literacy rate is very
low in this community. And these are the main social issues we found yesterday after communicating. Next one, please. Coming to this economy, dependence on agricultural activities, and their main issue is like farmers cultivate only jasmine crops and it is very seasonal. And the market is located 15 kilometers away, and the mediators, they take most of the money. And if you see the statistics, like 3 to 4 kilograms of jasmine, they give it for 1,000 to 2,000 rupees. That is very rare case actually. Sometimes even it goes below 500. Only the mediators or the beneficiaries over here, and if at all they get 3 to 4 kilograms of jasmine. So that's the main issue. And the next one is lack of proper income per day, 1,000 rupees for the construction work, but the construction work is not continuous work. If they have any painting work, it is very seasonal. And then next one is unemployment, lack of income because of unreliable work. None of the work is very reliable. It's all very seasonal. And then we asked, how are they maintaining their household things? They need to eat, they need everything, right? The basic needs. They said that they save the money and they use it. And the next one is lack of transportation. Because of lack of transportation, the transportation, only one bus which is available for every 4 hours, and they say even for every 4 hours that doesn't fly. Sometimes it comes in the morning and later in the evening. So it is a huge problem for them, even the transportation. Because of lack of transportation, they're not able to move around and get things done. And the next one is Mahatma Gandhi National Rural Employment, that is 100 days work, Noor Nal Veling. This is available actually because 3 of them came from this particular job. But what they say is the 100 days work is not given to them continuously. Sometimes only 20 days or 25 days. Even they do the work, the money is not deposited properly. Actually, the scheme says every 6 days, weekly wages it is. After the 6th day, it should be deposited out, and it's not happening. Sometimes after 1 month or after 2 months, it's been deposited, and it's a huge problem for them. So these are the economy issues we found in the community. Next slide onwards, Mr. Carlton will explain.
Good morning. I'm Dr. R. Carlton from Bishop Iber College, Trichy. I would like to insist upon 2 things. First one is the environment. So first on the environmental concept. So lack of systematic system, waste and waste management system is one of the major thing, because this village is having around more than 500 households. So like proper drainage system, sewage system, and also waste management. Like they generate a lot of waste, and they say they don't have the proper disposal facility, like biodegradable and non-biodegradable waste. So, and also they say they do the burning of disposing, because they don't have the panchayat people collecting the waste. Usually they collect the waste on daily or weekly basis. And lack of sanitation, mainly toilet is unavailable at every household, and even it is available, most of the household they don't use it. They do go for the open defecation system, which becomes a menace to the community and to the other people who use them. That is one of the major problem. And they say mainly there are a lot of schemes available in the government, as we know, for building up of toilets at household. Even then they are not opting out for it, and also mainly they are thinking of investing some money, because 50% is invested by the government, whereas we have to use the remaining money. And also mainly they talk about the soil, because sanitation system, they have the lack of soil, because mostly here they say they have the clay soil, which causes poor drainage system, and which causes water stagnation during monsoon and everything. And also water tanks, they say they have good availability of water drinking, but the improper maintenance of tanks, like overhead tanks, they don't clean it properly. So that is one of the major problem. So next slide, please. And for the governance, so mainly the Grama Panchayat, less they have the major problem lies with them, I think. We think mainly the schools and everything, they don't have the proper drainage or water facility. The school which we went, now it's being reconstructed and few buildings are being built up for betterment of the students. And even the campus ground and everything is not in a proper way. Even the classes have been equipped with a lot of modern equipments like ICT and everything, but the basic facilities they are lacking, and improper toilet facilities. And public services, as we talked about, I think most of the group talked about the public services, road transport. Here in this village, we don't have anything like no post office, no police station, or even a bank or an ATM. It is not available. For everything, at least they have to go for about 8 kilometers to access any one of these basic facility, or even 20 kilometers. And also, mainly the government, or there are a lot of implementation for drainage issue, the Amrut 2.0 scheme, Magnara scheme, which is mainly the 100 days system. 100 days wage system is one of the major governance problem, because they don't get paid, and also they don't get the actual or the better payment for them to survive. That is the major problem. Next please. And what are the main issues we discussed or we found out was, first one is the child marriage. As we all know, it is one of the crimes. It can be, the people who does it can be booked under the IPC. So that is one of the major problem. Even they are not aware of it, many things, because the literacy rate is low, the awareness level is very low. And as the healthcare, so even they don't have any camps being conducted, very low healthcare facilities, as no hospitals, or even there is a primary health center, but it is not being functioning for the past 2 years, they said. So because there is no nurse or a doctor visiting them. And higher education is one of the major problem. So they are ready to study, but the major thing is they don't have the lack of basic facility like higher education or higher secondary school. If they complete, it would be a better, they'll get a better opportunity. They'll have the keen interest to go for higher studies at college level. So even, and the roads which we went, we saw a lot of college buses passing through some of the main roads. So even then they are not opting out for, because of this time bound. And this village is located inside nearby an RF. They had to cross an reserve forest, which has no proper road facility like street lights, and everything is not available, so that they feel unsafe to travel during late hours, like maybe around 6 o'clock. So next please. Thank you.
Thank you, Mayu team. Thank you very much. Thank you, Malandur team, for your presentation. Now, who's left out? Kalpattu. Here comes Kalpattu. Team members, kindly move forward to the dais. have the presenter in the center with the team lead, Paneer sir and Karthik and Alamelu. Please come forward. And Rita ma'am, please help her. கரெக்டாக பொசிஷன் பண்ணிக்கோங்க ஃபோட்டோ எடுக்கிற மாதிரி. நீங்கள் தானே ப்ரெசென்ட் பண்ணுறீங்க, மைக் வச்சு நடுவில் போங்க, நடுவில் போயிடுங்க. அப்படியே ஃபோட்டோ ரெண்டு பேரும் நடுவில் போங்க, அப்போ தான் ஃபோட்டோக்கு கரெக்டாக இருக்கும். இங்கே கொஞ்சம் ப்ளீஸ் கம் ஃபார்வர்ட். சொல்கிறதுமா கொஞ்சம் இப்படி முன்னாடி வாங்க, கொஞ்சம் முன்னாடி வாங்க, இந்த எண்டில் முன்னாடி வாங்க. ஓகே ஷர்மிளா, யூ கேன் கோ இன் தி சென்டர். அலமேலு மேம் பக்கத்தில் போயிடுங்க. யா ஓகே, தேங்க்யூ. Kindly start the presentation.
So thank you for the opportunity. First of all, I thank the team who supported to come out with the presentation. So our target area was Kalpattu village, which is located in Tiruvallur district. It's a small hamlet. It is 2 kilometers away from the main. This is few kilometers, like 6 to 7 kilometers away from the main place called Vengal village. So this village has a total population of 2,050 people, including men, women and children. The main issues we identified, there were few men were there, only old women, men were there, a lot of young girls and women were in the discussion. So because we are a larger group, we have divided our group into two. So one group was in a community hall and another group was in a church. So we had a very live and a direct interaction with the community people. The main problem was the main economic activities are like they are all agriculture workers and some of them going out for seasonal jobs and mostly depend on the 100 days employment scheme. The target groups we have there in the village were between the age group of 20 to 70 years. And the best practice we identified was there was some unanimous things like there was a sports facility the villagers brought to the village, and there was one NGO called PACE. They were supporting the women for development work and also the youths to come up in life. So there are 5 self-help groups in the village and few of them encourage the children to go up to 12th standard. So there are one girl passed a nursing course also. That was a positive thing we saw. Next slide. Yes. So the main issues regarding to social was basically commutation, going out of the village for any emergency or anything. The bus is coming only 3 times a day, morning 9 o'clock and 5:30 in the afternoon, then late night 9 p.m. So that is a major hurdle for school goers and going for the people going for any work or anything. So and also the grocery shops are not available. They are 8 kilometers away. So they have to toil to go reach. There are bus facilities, but they have to walk 2 kilometers to get to reach the bus. So the second one was limited education. There was only one primary school with 2 teachers and a headmaster, and that school there is not much English classes, and that is also located about 1.5 kilometer. So the children has to walk, and the primary daycare center also located along with that. And the ration shop is also 2 kilometers away from the village. And regarding to health, they suffer a lot because there is no pharmacy, there is no health facility there, no hospital. Even if they call for an ambulance 108, it takes 2 hours to reach to the village. So any emergency, they find it very difficult to, respond to it. So that's a problem. Another one is a safety issue. There are thefts also happening, and also street lights are not there. And men with influence of drug, they come and they do a lot of things, abuse by the men, and also sometimes the murdered bodies of people from the neighboring cities or faraway cities are brought here and dumped and burnt here. That's another big issue for the villages. And another menace is a stray dog menace. That is another problem. And related to community, there are times they are segregated based on their community, so there was no unison in times of some troubles and all. Next slide. So the same issues. Another problem is during the rainy season, the water is stagnant in the area, so going out of the village is difficult for them. Same things. So then waste collection. There are number of families there, but the garbage collection process is happening once in a month. The vehicle coming and picking up the solid waste is once in a month, 30 days once. So there was a lot of garbage dumped here and there. So there need to be a solid waste management support for them. And regarding to governance, there was a poor participation or low participation from the active men in the village. And there is also the village leaders, their contribution is also not up to the level as expected. And another thing is a service dependency. There is like no provisional stores. If they want to purchase anything, they have to go to the main place like 7-8 kilometers away. So then the infrastructure wise, the roads are very weak, and also network, poor phone network. So that is also a problem for them to contact and access to any services, basic amenities and things. So then signage to the road, there is no road signages, and that has to be there so that the vehicle, anything is coming, even the ambulance is coming, they can reach there. And there is no playground, and it's already dilapidated. There are instruments, play instruments, sports materials. It is not in good condition. So the main issue we are addressing based on SDG 3, 4, 5 and 11 are poor transportation. And the available current schemes, there is no schemes for regarding to transportation. So what we are suggesting is introducing even a small minibus service during the school time, and improve of the roads so that the facilities will be there. Then the solar lights, because sometimes the cities in the village finds difficult without light. Then might be share autos to be encouraged to play in between, so that will be good for the villages in school going and working people. The next one is lack of health facility. That is a very basic thing, and it is addresses to SDG 3 and SDG 10. So we have there is a government scheme called Makkalai Thedi Maruthuvam, but the village health nurse visit once in a month. So no primary health center. I already told you the late arrival of ambulance, and no medical shop. Any emergency in the late night, and they are finding very difficult. What we are suggesting is linking up with nearby community-based organization or faith-based organization for technical support, and also mobile dispensaries so that they can receive a proper medical checkup on things. And we can request the government to have a sub-health center, primary health center, because 2,000 families are there. The next one is employment opportunity. Though they have a little opportunity with agriculture and a 100 days employment scheme, it is not enough to meet all their needs. So maybe what we are suggesting, currently there are PSCs, but limited services there with the PSCs, and also they are utilizing the 100 days employment scheme. What we are proposing as a solutions or skill training. So employable skill training. So that will be very helpful for them. And the NGO already conducted the training program, tailoring training for the women there. And they need some market linkage. They're ready to produce. And out of the 16 trained, 8 of them received machines. And they don't know how to market the product. And there is a high demand for the women items in the area. So they have to be linked with NGOs and like that. Then also connect with the government agriculture subsidy programs like vermicompost or any animal husbandry, poultry kind of a thing. It is suitable for the village so that they can find income to meet their requirements. Another one is education gap. There are 120 children are there as of now, but not many of them going to school. Maybe lack of motivation, lack of availabilities because of the school is only up to 5th class. So we can request to the local leaders to arrange for a school little above the level. And evening tuition support will be suitable for them. And English coaching is also needed. So they have to upgrade the school up to middle school and appoint one more teacher, so that will be ideal. So these are the main findings. I want to say one Chinese proverb. What it says that we have started typically yesterday. So the Chinese proverb says, go to people, learn from them, live with them, start with them what they know, build with them what they have. The best of leaders when the job is done. When the task is accomplished, the people will say, we have done it by ourselves. So anything would like to add, the team? So once again, I thank all the team members for the contribution. I thank you once again.
Well presented. Thank you team. Thank you Kalpattu. திருப்பி எல்லாரும் clap பண்ணுங்க. நீங்களும் உங்களுக்கே clap பண்ணிக்கலாம். Thank you very much. Group photo. நீங்க கொஞ்சம் உள்ள போயிடுங்க.
Thank you.
Thank you. Any remarks from your side? 5 minutes. No, we finished that. We will take a break and we'll come for discussion. I will reduce the lunch time. 10-20 minutes. We have overshot the time now. So, இப்போ நீங்க வந்து you can have So I would request Denison sir to summarize.
Okay. I think it's quite an impressive presentation. I do not want to try and summarize everything. Firstly, I think the field visit, I know there were some difficulties, but the visit has generated a lot of thoughts and ideas, and you have been able to summarize it well. So please give a hand to all the people who shared. Now, this is part of the methodology. Of course, this is a quick rush thing, which you then need to re-verify by further discussion, rechecking, and also talking to the people. Because in the place I went to, it was a bit difficult because you had non-tribal people correcting the people when they were giving the answers. So it's not a safe environment for them to talk. So that means there was the village, the Panchayat Talevar, every time a lady said something, he was correcting. So then it is is what we call in sociology authority defined. So if a policeman, if a district government servant is present, people don't tell you all the truth. They try to conform to the majority. But from the things I've heard from the four groups, I think the analysis is quite good. You can see trend of issues, whether it is toilets, whether it is, I think, over-dependence on the 100 days work, and the salaries are quite low, infrastructure issues, education. It's sort of a repeat of the problems on the ground by ordinary people in their ability to move socio-economic or social mobility. From what you all shared, definitely it is multidimensional. It is not a singular problem and all that. So I think it is quite good. I wish, if I was the organizer, to change the program, not have my presentation afterwards, actually return back to the four groups to find solutions. What will you do if you were given an opportunity, if you were given money, if you were given resources? What should we do? The problem with academic people or institutional researchers, we tend to define problems well, but we are weak at solutions. So how do you change the scenario? How do you influence policy in Tamil Nadu to address these concerns? And how can we see over the next 5 years changes? So that one requires strategy, it requires advocacy, it covers the need. So I think that, but we don't have that luxury. You have, so many of you have written abstracts, and the abstracts லாம் இன்னும் present பண்ணல. We have a tea break, we have a lunch break, all that, so we are behind time. But it is amazing that within the short span of time, we have identified this, and this is really for Nazareth group to see, because by going to the villages, you have created expectation. So in Malaysia, there are people who, local people who tell me, please don't bluff me. Don't come back if you can't find the answer to the questions I've raised or the problems I've said. Because researchers keep going back and asking, what is your problem, what is your problem? என்கிட்ட சொல்லுவாங்க, நான் போன வாட்டியே சொல்லிட்டேன், இது வரைக்கும் நீங்கள் என்ன செஞ்சுருக்கீங்க அப்படின்னு கேட்டுருவாங்க. So I think it's amazing work, and I think Dr. Mary and Mr. Henry will agree. We have described it well. There is a kind of a synergy in the team. There is the methodology that Shaza and others, Dr. Tana have put together, which has systematically brought it out. I think it's the next step. What would we do? In a year's time, if we gathered again in February 2027, what best practices or stories could take place? It will be amazing if you can bring some of the women here to also be speakers next time. They join us in the interaction and they become resource persons to share. The lady in our group who was really dynamic, I don't know in your group whether there was, in our group there was a lady called Lavanya. We went to her house, we sat down and spoke to her. She spoke amazing things. So end of the day, it's women empowerment that's come out, community empowerment. We know there is discrimination. The policies are not working. So it's actually sad if somebody doesn't have a toilet. In this age and time, Malaysia or any one of the countries, toilet and the safety of using a toilet is most critical. So I think we need to ensure that. I know the group here went and helped, but there are cultural barriers and other barriers that could be there. So thank you very much for your input, and I hope the follow-up, so the School of Social Work has a lot of work. Thank you.
Thank you very much, Dr. Dennison. So to add a few words, you will be formed into a group, WhatsApp group with the village name. All of you will travel with Nazareth College of Arts and Science for the next year. And as Sir said, Summit 2027, you will be submitting and coming and presenting your intervention, what you have done along with this. Thank you very much. Thank you.
Thank you, team, for those meaningful reflections from the field.
We now break for tea and networking. The refreshments will be served outside the auditorium. Kindly assemble shortly after for the discussion session at 12:25 p.m. sharp. I repeat, kindly reassemble shortly after the session at 12:25 p.m. sharp. Dear participants, those who missed to register today, we request you to register outside the auditorium and collect your tokens.
You have only 10 minutes. You have only 10 minutes. Please come back soon. The paper presenters, you will just have 5 minutes so you can plan your slides now. We're running short of time. 5 minutes for your paper presentation. We are reducing it from 7 minutes.
For the kind attention of the presenters, those who haven't sent your PPT yet, kindly send your PPTs to
SDG Summit